Ladies and gentlemen, at this point, these folks are never going to stop coming here. Never. Especially if you're going to be offering them health insurance, you're helping them get settled in housing, and you're giving them money, you're helping them get work permits. And I mean, as long as all this stuff is going on, you can best believe they're going to be flooding the zone each and every day like they are. In fact, it may actually increase. So, California is the first state to offer undocumented people that come across the border health insurance. California will welcome the new year by becoming the first state to offer health insurance for all undocumented immigrants. Starting January 1st, all undocumented immigrants, regardless of age, will qualify for Medi-Cal, California's version of the federal Medicare program for people with low incomes. Previously, undocumented immigrants were not qualified to receive comprehensive health care, but were allowed to receive emergency and pregnancy related services under Medi-Cal as long as they met eligibility requirements, including income limits and California residency in 2014. In 2015, undocumented children were able to join Medi-Cal under a bill signed by the then Governor Jerry Brown. In 2019, Governor Gavin Newsom signed into law an expansion of the full scope Medi-Cal access for young adults between the ages of 19 through 25, regardless of citizenship or immigration status. Access was then further expanded to allow older adults, 50 and older, to receive full benefits, also regardless of immigration status. The final expansion, going into effect January 1st, will make approximately 700,000 undocumented residents between the ages of 26 to 49 eligible for full coverage, according to California State Senator Maria Elena Durazo. Mm, mm, mm. This historic investment speaks to California's commitment to healthcare as a human right. In California, we believe everyone deserves access to quality, affordable healthcare coverage, regardless of income or immigration status. Gavin Newsom's office said in response to an ABC News request for comment. Y'all, you know what I'm thinking about right now? The Reparations Task Force in California. The moment it was done, it was leaked out in the news that Gavin Newsom did not want to give cash payments. And it's amazing. That task force in California turned in their findings July 1st. Gavin has not spoken another word about putting together something for reparations, but he dove out here to say he's giving health insurance to people regardless of their status, whether they're here legally or not. This is what he dove out here with, but not one single word on reparations. Let me go on. So, through this expansion, we're making sure families and communities across California are healthier, stronger, and able to get the care they need when they need it. You know, even if they get free health insurance through Medi-Cal, that's a lot of money that the state is putting out for this. But they don't have any money, y'all, for reparations. But they're going to make sure they got all of the federal dollars to cover insurance for undocumented people. But they won't go to that same federal government to get our reparations. California's plan to expand coverage has not been without its distractors. The California Senate Republican caucus criticized the move. An analysis of the 2022-2023 governor's budget. Medi-Cal is already strained by serving 14.6 million Californians, more than a third of the state's population, adding 764,000 more individuals to the system will certainly exacerbate current provider access problems, the caucus wrote last year. However, studies have shown that undocumented immigrants use fewer healthcare resources than do non immigrants. Oh, trust me, if you give them free healthcare, they will use it a lot more frequently. Trust me, they're going to use it a lot more frequently, especially if they really don't have to pay for it. Oh, hell yeah. So, anyway, however, studies have shown, okay, I read that part, about 50% of undocumented immigrant adults in America report being uninsured, compared with just 8% of US born citizens, according to the health policy research nonprofit KFF. So, due to undocumented adults being more likely work jobs that don't provide health benefits, as well as facing eligibility restrictions for federal programs. Additionally, undocumented immigrants who are eligible may face other barriers, including confusion about eligibility, language challenges, and fear, KFF says. This is despite low income undocumented migrants in California being about as likely as those currently enrolled in Medi-Cal to have at least one chronic condition, according to the research conducted by Public Policy Institute of California. Undocumented immigrants are also about as likely to receive preventive services, such as a flu shot, or older undocumented immigrants are about as likely to receive age appropriate health services, such as cancer screenings and shingle vaccines. Okay. So, anyway, California Health and Human Services Agency has committed $835.6 million in 2023 and $2.6 billion annually thereafter to expand full scope Medi Cal eligibility to all income eligible adults, regardless of immigration status. Wow. So he was able to get himself $2.6 billion a year to take care of these undocumented people coming across the border for health care. Why didn't you get $2.6 billion to cover the reparations in California? I'm just saying. Mm, mm, mm. When California expanded healthcare coverage in 2019, it included undocumented young adults. Then President Donald Trump blasted the plan, calling it very unfair to our citizens. If you look at what they're doing in California, how they're treating people, they don't treat their people as well as they treat illegal migrants. Well, y'all do that all over the country, actually. Y'all treat these people way better, especially the Black community. If we came to you and said we want free health care as part of our reparations, you would be sitting around screaming and hollering about it right now. But it's okay to give that to people that don't pay taxes. Those same people that would complain if we got it, they wouldn't have anything to say. Watch, they won't say nothing about this. But if somebody made an announcement today and said, you know what, part of the reparations, we're going to give the whole Black community in the US free health care, they would be screaming about it for the rest of 2024. Oh boy. Mm, mm, mm. Trump told reporters, this was when he was still in office at the time. So at what point does it stop? It's crazy what they're doing. It's crazy. And it means and it's mean and it's very unfair to our citizens. So that's what Trump said at the time when this came up and he was still the sitting president. So y'all look like Gavin Newsom already got this thing in motion, and it's going to happen January 1st. These folks are going to keep coming here in drove because you got governors and Congress, the Black Congressional Caucus, Joe Biden. You got all these politicians opening the door and telling them to just flood the zone. And that's exactly what they're going to do. And they're going to continue to do it. Okay. And let's see how many states will follow behind California. Because you can best believe, y'all, California is not going to be the only state that extends this to these undocumented folks that are coming across the border. And I bet you all of these states will be the same ones that got a problem with giving us reparations. Y'all tell me what you think about this video. Please leave your comment and subscribe. Don't forget to hit on the notification bell, and I'll see you on the next video. Peace, family.